Nutrition, Chapter 7, Alcohol. This is Martha Olson. Alcohol has many properties. It has a history being an antiseptic. They also use it to ferment drinks because it's safer than water in many places in the world. And during the Civil War, it was used as a painkiller after an injury. When we look at alcohol, we know that it has the abbreviation of ETOH, or ethanol. We know as methanol, which is a wood alcohol, is very poisonous. I actually have taken care of a patient that died from this, was a severe alcoholic, and turned to the methanol as a form of getting his high. For other people, besides death, it can also cause blindness if it's used. It's an organic compound that has one or more hydroxyl groups, or that OH on the end. It interferes with the intake of nutrients and how the body uses them. So as a person in a healthcare career, that is very important to know. It can damage every organ in the body. No digestion is needed. It absorbs very easily. It crosses the blood-brain barrier, so a person that has one drink can be a little silly and giddy within a few minutes of consuming their first alcoholic beverage. There is no storage in the body, and there is a very narrow safety window for alcohol, and many people consider alcohol a drug. There are many sources of alcohol. As I said, they use yeast cells to metabolize the sugar, and so oftentimes it is considered in the carbohydrate family. Beer and wine contain unfermented carbohydrate and a very small trace of protein in that, but as we said, the absorption of alcohol kind of gives it unique properties. When we look at what is a drink, we know that 12 ounces of beer, 5 ounces of wine, and 1.5 ounces of a distilled spirit is considered drink. Women, no more than one drink per day is considered moderate drinking, and men, because of the larger body size, more muscle mass, no more than 2 drinks a day. But again, you need to look at the size of the person to kind of help make that determination. When we look at the alcohol absorption, we know that GI, the aldehyde dehydrogenase, does not completely convert the acetaldehyde to acetic or acetate. The remaining acetaldehyde then is actually more destructive than the alcohol itself and damages all the way from the mucous membranes down through the lining of the gut. That's why when we talk about alcohol actually affects every organ of the body, we know that going down the esophagus, alcohol burns, and it predisposes that person to GERD, to esophageal cancer, many things that go along with that because of the damage to the mucous membranes. The detoxification of alcohol always takes priority over the operation of the citric acid cycle. It slows the citric acid cycle, and that in turn then the cells route most of that acetyl-CoA, or that energy, to the fatty acids, and it winds up being fat. So a fatty liver is that first stage of alcohol destruction of the liver. And we know with chronic use there's an increased tolerance to alcohol and other drugs, such as sedatives, tranquilizers, and antibiotics. So when we have a person that is an alcoholic and they come into the hospital and we give them a sedative or a tranquilizer, a pain pill or a sleeping pill, they don't get the same effect because their body is so very used to that alcohol presence. Removing alcohol from circulation, we remember that the liver is the one that breaks down that alcohol at various rates. The morning after and treating a hangover are some slides we have coming up. We know that sometimes the morning after is an unpleasant time, and treating a hangover really just takes time. When we look at alcohol in the body, to get it from the circulation or out of the circulation, sometimes that liver metabolism is very limited. It can only metabolize a certain amount of alcohol per hour. So a person that drinks very rapidly, or in some of the instances where there's challenges as to how much a person can drink in a short amount of time, the liver is not able to handle that amount. Alcohol peaks in about 30 to 45 minutes, and it enters that general circulation, diffusing rapidly to all body fluids, including cerebral spinal fluid, into the placenta to gain access to the fetus of a pregnant woman. Overdose of alcohol and lack of oxygen to the brain shut down breathing, And many of your patients that have a very high intake of alcohol will actually quit breathing, and that will be the cause of their death. Passing out is actually a protective mechanism the body has. You pass out when you can't drink anymore, and the body then kind of shuts down everything. And we've seen, unfortunately, alcohol poisoning deaths, and that's from the overwhelming alcohol to the body, and it can't detoxify. Or, as I said in my other PowerPoint, aspiration is also a complication we unfortunately see. When we look then at the different differences in alcohol metabolism, we know that there are gender differences between men and women because of the body size, hormones, enzymes, and then body composition because of the fat versus muscle. We know that Asian descent has more flushing common in people of Asian descent because they lack that gastric alcohol dehydrogenase. And we know that Europeans tend to be able to metabolize larger quantities. Maybe that's why the Germans have Oktoberfest. And then with females, we know that alcoholics have death rates of about 50 to 100%, much higher than male alcoholics. So in looking at when it becomes a problem, we know there's, again, increased risk of esophageal and stomach cancer. It changes the neurotransmitters in the brain, so you have less inhibitions and physical coordination, and that's why we oftentimes, especially in college campuses, see with that lack of inhibition more rapes, more unwanted sexual activity as a result of the body's changes from the alcohol. And then the physical coordination, you know, the slow reaction time, the staggering, falling, other injuries that happen as a result of the coordination. Increased quantities consumed quickly on an empty stomach can make a person have what we call a blackout. And a blackout is where you don't remember anything that happened during that period of time. Lack of food depletes your glycogen stores, and we know with heavy drinking it suppresses gluconeogenesis, causing a condition called hypoglycemia or low blood sugar, and then the brain cells can be permanently damaged. When alcohol becomes a problem, my background, first job out of nursing school was working in a drug and alcohol rehab unit. And so I've seen a lot of fatty liver and fibrosis. When they come in for the 28 days of detox, we would run the liver panel tests and they would be sky high. Just unbelievably off the charts for their AST, ALT lab tests. After 28 days of treatment, we redid them before dismissal and they did improve, but those liver enzymes never really went back to where they should have been within normal. First is that fatty liver where it recedes with abstinence. So if we can get to that person and get them dried out early, we can see then that fatty liver will repair itself. With fibrosis and continued drinking, the tissue becomes fibrotic and there's very little change after a person quits drinking. And then the final stage is the scarring or cirrhosis, usually after about 5 to 10 years. Alcoholic hepatitis or that persistent inflammation of the liver is very common with the long-term alcoholic. And then our fetal alcohol syndrome, I'm assuming most of you have read about that. It seems like a topic that a lot of high school kids do in some of their classes. We know the congenital defects of mental retardation, eye problems, malformations, low birth weight, and facial abnormalities are often seen with that child. And there is no safe amount of alcohol. One drink during the right period of time during fetal development can cause fetal alcohol syndrome. So, and the other problem with fetal alcohol syndrome is many of the women don't know they're pregnant during those first 6 weeks of pregnancy when most of the body for that infant is being formed and developed. It's especially damaging again during the early weeks of pregnancy, and we want to get the word out to avoid that. As far as malnutrition, we know that many alcoholics have a poor diet. They are getting the energy, the 7 kilocalories per gram is consumed, but their other calories are non-existent. And so they get very little vitamins, minerals, and other sources of good nutrition in their diet. Economic factors can also be a factor where they spend all of their money buying the alcohol and not spending money at the grocery store on food. And then they really don't care. They have a lot of GI distress or GI problems that cause them to not really feel hungry or seek food. With alcoholism, we also see elevated iron, copper, and nickel in the blood, and then the triglycerides are usually sky high, and that's because the triglycerides are the liver and they're damaging the liver. For the specific vitamin deficiencies, we know that thiamine is replaced. When I worked in the drug and alcohol treatment unit, thiamine 1 milligram was given intramuscularly for the first 3 days. And then after that, they got a multivitamin for the rest of their stay with enhanced thiamine in that. What we're trying to prevent is a condition called Wernicke's encephalopathy, which is a thiamine deficiency that causes almost like Alzheimer's type changes for that person. Scurvy or vitamin C deficiency is often noted in your alcoholic, as is a risk for bleeding and anemia. And if you think about the fact that the clotting factors made in the body or in the liver, and the person has cirrhosis of the liver and changes in the liver, they are not making the clotting factors needed. An alcoholic is a very high risk person to take to surgery for the risk that they do have of bleeding. When we look at alcoholics and malnutrition, then, as I said, it interferes with a lot of the amino acid absorption. The body weight tends to be normal for a person, but it's very unhealthy, and you can see other characteristics in their appearance and in their assessment that tell you they may be of normal body weight, but they are not healthy. Drinking patterns are important to look at, the amount consumed and the quantity, and then how often they drink. Does alcohol have any benefits? They say that, the protection against the heart, the French that drink a glass of wine at night have lower rates of heart disease, but you also have to remember that they follow closer to a Mediterranean diet with different types of oils used in their diet. So can we specifically say that alcohol causes less heart disease? Not really. When we look at energy drinks and alcohol, we know that that's kind of a risky recipe that should not be consumed, and our calories in alcoholic beverages add up very quickly. Even like a light beer has about 103 calories in it, and as our other PowerPoint showed, those calories add up over time to usually weight gain. Freshman 15 for college students, or a drink every night can add up very quickly to unintentional weight gain. As far as alcohol poisoning, we know it's an overdose of that where the body cannot metabolize it quick enough, and the person will either pass out, black out, vomit, and aspirate. Something will happen to that person as a result of that increased amount of alcohol that's consumed in a short period of time. Our cure for a hangover, they talk about bland foods, complex carbohydrates, get water to replace the fluids, because alcohol is a diuretic, and the person is usually very, that cotton mouth that you have, it's from that lack of fluid or hydration in the body. Thiamine, banana is a good food for a hangover because it has the potassium in it. And then avoid anything with Tylenol, because Tylenol is very damaging to the liver. And I've even read before where taking a Tylenol before you go out and drink, trying to avoid or prevent a hangover, is a very bad idea, because that Tylenol in the liver, when the alcohol is first introduced, causes severe damage. And there are people out there, research, that are waiting for a liver transplant because they did just that. And it wasn't that they were long-term drinkers or had a lot to drink, it was the Tylenol before drinking that caused that. So that's my soapbox for all of you today. Our fetal alcohol syndrome, as we talked about, is damaging during early weeks. It affects many areas of their life. Many of these children do very poorly in school, have poor growth, and have a lot of learning disabilities as a result of that. So prevention is key. This ends our PowerPoint. I hope it was helpful and informative for you as you continue on with this unit.